and adopted new ways of conducting our affairs. Indeed, our economy has been adversely affected, business plans interrupted, jobs and livelihoods have been lost. This is now our new normal, unfortunately. However, we can turn around this situation within a short time if we strictly adhere to what we have said. Ladies and gentlemen, we have scaled up our preparedness in response to contain the disease. We have scaled up our personal protection equipment, where we have spent millions of shillings, upwards of 140 million. We have tested over 8,000 samples from quarantined persons and their contacts. We have mobilized over 500 ventilators for critical care. We have manufactured and distributed millions of liters of sanitizers. We have sensitized over 100,000 health workers and community health volunteers. We have set up isolation and quarantine facilities. And towards this end, we have set up 1,664 isolation beds across the counties. We have developed and circulated COVID-19 protocols on pediatric response, community response to COVID-19, and burial protocols, among other, and also set up and operationalized the Kenya COVID-19 Emergency Response Funds, set up by His Excellency, the President. In this regard, we are not working alone. We have been led from the top by the President himself. We have been working with a lot of other government agencies, county governments, private sector, and international organizations. I want to acknowledge also, as opposed to popular opinion, that the role that has been played by Parliament. We have had engagements with the two houses, with parliamentary leadership and committees of both houses. These engagements have contributed to the overall response and intervention measures. As late as last week, we had meetings with the health committees who provided input into way forward, who provided support for how they are going to work in Parliament to provide funding for the work that is still going on in our ministry. And therefore, we want to say that Parliament has been active in the work that we have been doing, and members of Parliament have contributed to the work that is currently going on. Kenyans of goodwill have come out in large numbers to offer material and financial support to the vulnerable members of our society. We want to appreciate them and their generosity and appeal to others to do so. However, as we streamline the manner in which those contributions are made, it is important to work with the structures provided by the government so that we can avoid the kind of riot situations that we have seen in some areas when food support is taken to them. It is time indeed to lend a helping hand. We encourage benefactors at the county level, businesses, organizations, and individuals to liaise with the county leadership to ensure that their help is channeled in an organized manner. We would particularly like to stop and desist from making any support that means or that brings people, crowds of people together. Because at that point, instead of helping, you may very well be spreading the disease. So we would like this support to be channeled properly and done in a very organized manner. Fellow Kenyans, we are aware that the burial of a COVID-19 disease victim in Siaya County has raised some concerns. This is an issue that we are currently addressing together with the county government of Siaya in line with public health and sensitivity to the dead are concerned. However, I want to inform the country that moving forward, there will be challenges. I want to say in an honest term as I can, and be brutally honest, that our cultural practices on how we dispose the bodies of our loved ones may not be practical in an extreme situation. I therefore want our people to be mentally prepared and to accept that COVID-19 victim bodies shall be disposed in a manner that protects the living from infections and in accordance with the Ministry of Health burial protocols. In addition to that, I would like, on a separate matter, to send in an increased appeal to our employers and to ask them to treat their employees in a humane manner. We have situations, for example, where employees have been sent home on unpaid leave. I appeal to the employers, even if you cannot be able to pay the full salaries that people earn, please consider supporting at least for minimum requirements of the household. Consider supporting your employees so that at least they can be able to put a meal on the table. I also appeal to those people, for instance, in fraternities that hire people on a temporary basis. For example, the golfers who employ thousands of caddies. I implore you to think about the caddies even when they are at home. Consider, and I know some people are already doing this, some golf clubs and other institutions are already doing this. But I implore you to kindly consider, once again, putting a little money in their pockets via WhatsApp, not via WhatsApp, via M-Pesa, and other avenues that you can, to put a little basic money, just for basic foods, on their tables. Let me now report that in the last 24 hours, we have tested 674 samples. Out of these samples, 11 have tested positive for coronavirus disease. And so we have now passed the 200 mark. Our figure stands at 208 persons tested positive in our country. All the 11 are Kenyans. 4 have a history of travel from the United Arab Emirates. 6 are male, while 5 are female, aged between 1 year and 42 years. The spread of the cases with regard to their counties of residence is as follows: Mandela, 4, Mombasa, 3, Nairobi, 2, Nakuru, 1, and Machakos 1. 4 of the cases have emanated from mandatory quarantine centers, while 7 were picked by our surveillance teams. Over the same period, 14 more persons have been discharged from hospital after successful treatment. And 1 other positive case has also turned negative after a mandatory 2 tests. Cumulatively, therefore, we have 15 new recoveries in the last 24 hours, bringing the total figure of recoveries to 40. We have unfortunately also lost 1 more patient in Nairobi, bringing the number of deaths to 9. A total of 2,306 contacts have been monitored, out of which 1,687 have been discharged. 619 contacts are being followed at the moment. I thank you. I would like, before I take questions, I would like to ask my colleague, the Education CS, Professor Mahoga, to come and say just 1 or 2 things on the support that we are working, the method that we are working on with the ministry, with his ministry's institutions, and then perhaps you can take a few questions thereafter. Prof.
I want to confirm that that was an ambush, but since I'm here, I think what is in the mind of every Kenyan is what is happening to the children. The first point is that the children are at home and they are safe. The second point is that we are offering online education through a battery of systems, and a large number of those children are carrying on with their learning as is expected. The third point is you are going to ask me that there are some children that cannot receive online education. That is correct, and that is being addressed as we speak through various machineries. The fourth point is when will the schools open? I think your answer is as good as mine, but in order to allow the nation to become, you are aware that our facilities are being utilized for the time being to control the coronavirus disease with very good results, extremely good results, because we had projected about 5,000 at this time, and we are only at 200. But people should have peace because we are working on various modalities. When the time is ripe, we shall tell you the various options, which again will depend on my brother Kagwe's handling of this matter, which he has been doing with sterling efficiency. I would want to encourage everybody to wear masks because I'm seeing, unfortunately I'm a medic, I'm seeing even some of the members of the Fourth Estate are not extremely serious. They have no masks, and their distance, strictly speaking, is not 1 meter, Honorable Minister. With a tongue in the cheek, can we be extremely serious about this? Being a Luo from Siaya, I would like to pronounce myself on the issue of the burial at night, I think yesterday. What is our goal? Our goal here is to ensure that the disease is controlled. And we have given various protocols which must be done. And there's a very big risk of people leaning towards culture and forgetting that what has been done is in the overall interest of the immediate family, the extended family, and the family at large. So I would like our people to bear that in mind as you condemn or have anything to say. And to encourage my brother, C.S. Kagwe, who is now half a doctor, I think he's even doing more than half a doctor, that he should continue precisely with the way things are going. I thank you very much.
Let me also ask Governor Kuti to say something. Governor.
Thank you, Waziri. I would like to be very brief. Number one, I would like to congratulate the effort of the government, both national and county. But more so, I would like to congratulate Kenyans for heeding the call to wash hands, to keep social distance, to avoid crowding, which now I think has put us very much below what our models had shown at the beginning. But I would like to say that the people who really are keeping or rather heeding the call of the government are more in the urban centers, especially Nairobi. And since Nairobi was initially our epicenter, and they have really followed the advice of government, that's why maybe we are having this turnaround. The fact that also we congratulate His Excellency's call to lock the counties where things were happening has also helped us a lot. Where we are having a lot of challenge in terms of behavior change, in terms of the call for social distance is still in the counties, especially the rural counties. People at the markets, I'm glad churches and mosques have been closed. That has helped a lot. But at the market, open air markets, and in towns, in supermarkets, in the rural areas, people are not very serious. And since now we are starting to see cases appearing in the counties, our worry now is actually those counties. Mandera has had 2 cases. Today it has had 4 more cases. It has 6 cases. And slowly Machakos and the rest are also starting to have cases. Unless those counties behave the way Nairobi behaved. Nairobi behaved very well and kept their numbers low. But because now rural counties are still thinking this is foreign matter that has come to Nairobi and is still far from us, the behavior in rural counties is still very worrying. And therefore, and now the disease is slowly moving in that direction. And therefore, I request, or rather I ask the county emergency response committees to put more effort. The curfews have assisted a lot, but during the day, we need to push harder. The issue of washing hands is doing very well, but social distancing in the markets especially is still a worrying trend. I would really ask that we push for this agenda at the county emergency response committees. Thank you very much.
Asante sana. Can I finally ask CS Musheru to just say one word, and then you will be allowed to ask a question and say to whom the question is directed.
Thank you, Waziri. One word is very short. I have a few more things to say, but first is to thank the media. I think the media have stood with Kenyans. They have shown that, and they have continued to air, what the government, the Ministry of Health, and everybody has been saying about keeping safe. We are very pleased as a ministry that we've been able to work with them in terms of just ensuring the information continues. We're seeing some people in some places celebrating that they've been able to pass through, for instance, some of the roadblocks. Really what we as government are doing is to safeguard Kenyan lives. It's not for just for fun. So when you try and go through these things breaking the laws, it is not always helpful. One thing that I also wanted to add, our chairman, is that today's meeting, the National Emergency Response Committee, we had almost 50 people attend that meeting. Majority of the people attended using technology, on video conferencing, and some were even outside of Nairobi. We're working hard as a ministry to make sure that we have sufficient capacity in terms of internet so that people can be able to have the connectivity and video conferencing facilities that exist. I know we had discussions, the president launched the balloons. Hopefully those will come in time. And they should be able to allow us, Professor Magoha, to even have all classes in the country be conducted even through the video conferencing and infrastructure facilities that we're putting in place. This will help us as a country both in terms of saving money, but allowing people to work from wherever they are and ensuring that we have the distance, social distance that we need. But economically also we are saving a lot of time. We're saving a lot of money, and this will help us even in the long term, even after this COVID pandemic that is actually ongoing. At the moment, it is still not clear how long this pandemic will be, but we need to prepare and be set, and therefore I want to even thank the mobile operators for the amount of support they have put in, including the network providers, to ensure that we have sufficient bandwidth available in the country for those that want to be able to continue to work from home, to work from their mobile devices. There's plenty of work that is now available online, even in the international communities. So as a team, we're working together on the Ajira platforms just to let people know where these jobs are and where they can actually be able to contribute and still earn some money. So we'll have more sessions to discuss this, and thanks Waziri for this opportunity. Asanteni.
Asante sana. Before we start the questions, I just want to add just one small thing. That it is very important for us to appreciate that the steps that have been taken by the government have had some impact. And I accept that. But I think it is so important also to appreciate that if we let go at this moment in time, if we ease off on what we are doing, then we can have a wave like we have never seen. I don't want to push the envelope to say that we want to make people panic, we want to threaten people. It is not the case. But I just want to warn that a little success should not be construed to mean a real success. So I want to warn that, yes, the projections were a lot higher than they currently are. They could have been even higher than we said. Certain containment issues, certain containment measures, we are sure have had some effect. But that is not to say that we are nowhere near out of deep waters. So let's keep that in mind. Yes. Let's move on. Take a couple.
There are people with special needs, especially mothers, breastfeeding mothers, pregnant mothers, and what are some of precautions that you're taking for such special groups? And then number two, you've been urging employers, for instance, to consider their employees not to, probably like today you said you are urging them not to really send them on compulsory and paid leave. But even for the landlords, you urge them to really consider asking their tenants to pay their rents. But as at now, I can say the ground, things are different. People, that has not been adhered to. Probably people are asking, are we going to have a directive in that regard?
Thank you so much. Seth Olale, NTV. KMPDU had a press briefing earlier today.
Who is the question towards, Orore?
Oh, it's towards you. CS. Yeah, KMPDU did mention earlier today that up to 4 doctors.
Hey, what, sorry?
KMPDU, the Kenya Medical Practitioners and Doctors Union, did say that they have 4 doctors, 10 clinical nurses, and up to 70 health workers in quarantine. About the 4 doctors and 10 clinical nurses that they have tested positive. That is according to KMPDU, and that they have up to 70 health workers in quarantine. This
70 health workers in quarantine?
Yes, according to them, and they say that this is because they did not have PPEs. What is your response to that? That is one. Number 2, this is for Solo Governor Kuti. In regards to you stating that the rural centers and especially the counties should more actually exemplify what Nairobi is doing, why can't we just have those rules being taken to the county rural centers in terms of, yes, like you say that Nairobi is doing well and that is why we have now maybe cases moving to the counties. Why can't we have those stringent measures now going to the counties? If it is in terms of cessation of movement order, why can't we have them in the counties if now that is a problem that they're not doing what Nairobi is doing? Thank you.
Okay. Sorry, I don't have a mask. I take this seriously, Professor Magoha. I'm Vera Okeo from the Daily Nation. Maybe this will go to CS Kagwe. It's obviously clear that we're not going to do mass testing. It's going to be targeted because we can't test the 47 million.
Please speak up.
It's obvious that we are going to not do mass testing. It will be targeted. So I would like to know when this will start and the strategies you'll use to choose who to test in amongst the 47 million. And then secondly, contact tracing is a very vital tool in curbing this at the moment. May I know whether you have enough people to do contact tracing? And if not, are you considering probably using public health officers? Because there are other healthcare workers who have not been utilized at all in contact tracing. Thank you.
Okay, Mutahi, the last one.
My name is Mutahi Kagwe from TV. And just taking it from Vera Okeo, and the question is for you, CS Kagwe. In the Siaya case, the gentleman seemed to have traveled a lot and gone through various areas and possibly met a lot of people. So how many people so far do you have possibly on quarantine, and your appeal possibly to those who may have interacted with him to possibly report to health officials?
Okay, thank you very much. Let me start with the fantasy that has just been expressed regarding health, the 70 health workers in quarantine and such other statements. It always baffles me when one is so happy, and so anxious to insinuate that more Kenyans are sicker than the ones that are actually sick. It's like a prayer that we get more nurses sick, and we get more Kenyans sick, and we get more doctors sick. All I can say is thank God that it is not the case. All I can say is that it is good that the question is coming on this Monday, that is during Easter, that we talk about life conquering death. So people will always have their own fantasies and their own reasons why they would like to put down others, put down their community, put down nurses. We have got a very senior nurse here who can confirm whether indeed it is true that that is the case. So I don't want to dwell too much on that, because then I become just like the fantasizer. On the issue of special needs, it is true that most of the people who have died, the deaths that we have had, most of them have had underlying problems, diabetes, you know, and so on and so forth. But I will let, I'm going to ask the doctor himself to speak on that issue of the underlying issues and so on and so forth. Then there is the question of the landlords. As I asked for the employees, it is true that even the landlords ought to be a bit more sensitive to the fact that people are not in the situation that they always are. But I also want to say this, that this is a holistic, we have got to have a holistic approach, and there is a committee that is working on the economic impact and the way we need to address the economic issues, you know, related to COVID-19. And to say that it is something the employer will be able to keep the employees going if the banks are not also harassing the employers, you know, to pay their loans, and to the extent that the employees are not really earning money for the companies. So the banks also ought to be appreciative. And I know that the president has dealt with them and has heard on the financial sector, and I know a lot more work is going on there. So hopefully it will happen. The same institutions, you know, must also address the landlords, because if a landlord is supposed to be paying a loan to the bank and the bank is still harassing the landlord, then you can see how the landlord is unable to do anything. So it's a chain of events that must take place so that the economy can operate in a humane manner to all concerned. On the issue of mass testing, yes, we have started testing as many people as we can. And as I had said yesterday, it was reported, and I want to confirm it, that we have capability now of testing quite a number of people each day. We can test over 1,000 people, or even more per day. The limitations are different. Limitations are in collection of the samples and so on and so forth, not the testing itself. But who to test? You have got to move in a very targeted manner in order for that testing to be effective. For example, if you know that an institution has had 1 or 2 individuals who have tested positive, it makes sense to say, let's first of all round up this institution and test all those workers who have been working with that person. The second area is that if you know there is a cluster, if you know there is a cluster in Umoja or a cluster in Kilimani, then you would think that the sensible thing to do would also be to start with that area where you know that there is a cluster. If you have been contact tracing, then you'd want to first of all test the ones who have been in contact with others as you roll out to the general public. So yes, there is a plan in place for that. For example, and to marry that with Shemtai's question about the Siaya case and the contact tracing. So far, we have got 45 people in quarantine who come out of that one individual within Siaya County, and more we will probably be joining them in the course of the day and as we move into tomorrow. So those are critical people that one must test. And therefore, even as we talk about mass testing, there is a method that one needs to pursue in order to be effective and efficient. I want to call on Professor to respond to some of the education issues that have been raised, and then the governor can respond to his.
Ladies and gentlemen, we closed schools at the point at which the government closed schools. We had 10 weeks. So I don't understand what all this hue and cry is about, because the only time we have lost so far is 3 weeks. Right now, my children are enjoying their holiday. until the end of the month. We have to be together on this one. So if we have to worry, we should be worrying as to when we shall be able to control this phenomenon and whether or not the children will open on the 1st of May or 2nd of May as we had planned. And I want to say this very clearly, that we have already worked in the back room and we have certain scenarios which I shall not divulge to you at this time, because those scenarios also depend on how we are seeing my brother Kagwe proceeding with the coronavirus. We are not going to risk the lives of our children because dead people do not take exams. So the parents should should remain calm, and I want to challenge them, if they have television sets in their own houses, to see what is happening elsewhere. We have still not reached a stage where we are saying we are going to postpone this, we are going to do this. Don't put words into our own mouth. If and when the time comes, we shall tell you whether issues like exams will still be held. As at now, I, as the head of the sector, do not see any reason why we should postpone exams. But today is only the 13th of April. What would happen? Don't listen to those people who are making noise out there. This is a free country. You can make as much noise as you want. We are being led by a field marshal who is His Excellency Uhuru Muigai Kenyatta, and he has empowered us to use our brains to give the best results to our people. So there's no reason why any parent should be anxious, because when the time comes, we shall actually tell them what they should do. And there are several scenarios. And they will be shocked that perhaps they were getting blood pressure for nothing. The second question is very vague. I have small children and I also have adults who go to universities. With regards to the small children, from pre-primary 1 to Form 4 in secondary school, that is where my heart lies. And it would be crazy for anybody to want to charge any of those children for the content that we are giving them, which is free of charge. But we also have the private schools who may want to give additional content, which is made by their own teachers. And the question you ask yourself is, if they are going to pay those teachers, they must pay those teachers from money that comes from somewhere. So it would then be reasonable for private schools who are giving online content coming from their own teachers to charge for them. As far as university is concerned, and I have been at the university for over 30 years, and I believe you have also all been at universities. If you are going to do a course, that course is prepared and administered by a lecturer. That lecturer has to be paid by someone. So you will argue that for private universities, it is absolutely in order to charge. And for those students in public universities who originally were paying fees, market fees, there would be nothing wrong in charging them. The students sponsored by the good government of Uhuru Muigai Kenyatta should not be charged anything. The challenge that's going to come out of this is that will universities keep their faculties, both in private and public, and I believe that the government is dealing with this as we go along. Thank you very much.
I think the question on why the counties are not following suit in the measures that have been taken in Nairobi in order that the spread does not flare up in the counties. I think we are monitoring the situation as a government, both county government and national government. And we've made certain decisions and moves together. And we are monitoring this situation very closely. Of course, when the cases happened in Mandera, the counties neighboring made certain decisions to block entry and exit out of that neighboring counties. But in terms of deciding a lockdown or a movement control, the national government, obviously headed by His Excellency the President, has the prerogative in making that decision, and we always consult. At the national level, you can see in the National Emergency Response Committee, the county and the national government work together very closely. The same with all the counties, all the committees that have been formed as relate to COVID-19. And these decisions are then made together. So we are monitoring the situation very closely, but we are trying to alert that the issue of social distancing, especially in the markets, is a major concern that I am asking the county emergency response committees headed by the county commissioners and the county governors to really create a lot of awareness through radio, through moving in the counties and explaining to people, because that's where the weakness lies right now in the rural counties. Thank you.
Thank you, Chair. Mine is just to highlight on the issues of the people with special needs. Yes, indeed, we have had a few cases of people with special needs, like breastfeeding mothers, people with physical disability. And of course, we have taken good care of them like the rest of the other people, including foreigners. In fact, today, of the 12 or so people discharged, 2 are people from the Democratic Republic of Congo. So in terms of caring for these people, we care for them like any other person, but taking into cognizance the special needs that they require. As of today, we have 142 cases admitted in various hospitals all the way from the coast to the northern part of Kenya. And out of these 140 are in very stable condition. 2 are in critical condition under ventilatory support. And of these 2, 1 is also on dialysis. Though as from yesterday, his condition has also improved. It is true that healthcare workers, because of the nature of their job, will get exposed, and in some cases will even get infection. But as a ministry, we have tried to make it possible. We've tried to do everything possible to ensure that the frontline healthcare workers have the necessary protective gear to protect them when they serve other sick Kenyans. Those who happen to fall sick in the nature of their duty, of course, the ministry has continued to support them through offering psychosocial support, ensuring they are comfortable as they take their treatment, and hopefully very soon we'll have 1 or 2 come out of treatment. Thank you.